Prescription for Health program is a great example of how they vouch for the community and how they do so much for our patients, the gym, and all the resources we have here. So I'm really grateful, and I ended up starting here, and here I am.
Welcome in, folks, to another episode of For Your Health podcast to discuss Rowan General Hospital's Prescription for Your Health program. We've had a lot of fun talking with a lot of different people over the weeks and months of this podcast, and we're looking very much forward to our guest today. We have Dr. Mousa Dajjani, who is a new provider here at Rowan General Hospital. He is a family medicine practitioner at Rowan General Medical Clinic. Dr. Dajjani, thank you for joining us first.
Thank you for having me. Really happy to be here, and this is my first podcast ever, I would say. Never had a podcast, never been in one before, so it's exciting.
Well, when I first met you, you came to our radio station and said you had never cut an ad before as well.
Yeah.
And you seemed like you were an old hat at that.
Yeah.
So we're looking forward to having a conversation today about some specific types of medicine related to diabetes management. But before we get to that, I want to talk about you and your background and your history and where you came from, how you became a doctor, and how you found yourself in the small rural community of Rowan County.
All right, so I guess we'll start from the beginning. I was born in Canada, and then I traveled around the Middle East. That's where I'm originally from Palestine, but I'm Canadian citizenship. And then I kind of got into this volunteering positions wherever I went, just helping others, whether it's in like in a mental health facility or just in the Red Cross and stuff like that. And I developed a passion through it, and I had a lot of ill family members that we had to, like my grandma with cancer, had to take care of her. Interesting enough, I was torn between engineering and medicine when I applied, but I tend to lean more towards science, and I excelled at it. And then I did my undergrad in the University of Toronto in psychology and biology. And then I went to the Caribbean, the island of Curacao, if you heard of it. Mm-hmm. That's where I did my medical school classes and training. And then I did my clinicals in the U.S. in various states. And then when I applied to residency, I matched in West Virginia and Charleston Area Medical Center in the family medicine specialty. And that's probably the best thing that ever happened to me, because I never thought I'd stay here, never been to West Virginia, and then here I am in the state. And then when I was looking for jobs, I wanted to get into a position where I'm able to serve a community, help the community. And I think, Spencer really is a perfect place for this. And the Prescription for Health program is a great example of how they vouch for the community and how they do so much for our patients, the gym, and all the resources we have here. So I'm really grateful, and I ended up starting here, and here I am.
So you mentioned that it was just natural, a proclivity you had to help people in your family and help people around you in certain ways. Did you think as a youngster that the field of medicine would be a path you would be interested in?
Yes and no. I would say I kind of was almost like I was always into helping others, but I didn't know if it was like I wanted to do be a psychologist or and then I also thought about engineering at some point, but it was always on my mind. And there's a funny story. When I was in elementary school, the teachers had complained to my mom that my handwriting is not legible, and my mom literally said, "What if he wants to become a doctor?" Until this day, she actually mentions that story. So maybe it was
perfect for you.
Yes.
And you were not meant to be anything but a doctor.
Yeah. So it's funny, but yeah, I think it was always in the back of my mind, and I think it was meant to be, because the more I learned about biology and science and got into these positions and got into medical school, I tend to lean more towards primary care as well. So I think it was always somewhat in the back of my mind. I thought I would be in the medical field.
Well, you obviously have a very good base family-wise when you talk about wanting to be helpful to your close family. And to be able to move to a small community like Spencer and like Roane County, it is a very family-oriented atmosphere. Even though you're rather new to Roane General Hospital, it doesn't take long for your patients to become very close to you, because around here we share everything, and you'll find very quickly, if you haven't already, that people will tell you about their family while you're talking to them about their health and wellness. So it's a very nice fit for you, I think. I hope that that's something you've seen as you've started your career here.
Oh yeah, I've already seen. I've been here. This is like 3-4 months now, and one family member comes to establish care, and then they tell their family members, and then suddenly I'm seeing the whole family, their cousins and their nephews, like, oh, my grandma told me about you, and I want to see you too. So it is rewarding in that sense, because you feel like you're not just contributing to the community, you're actually helping families as in wholes, and it's pretty good, and I've already been seeing that. So
you got great word of mouth advertising from family member to family member. Now you come at this again as a family practitioner. So again, as you mentioned, you see a lot of family members, and obviously, as a doctor, I'm sure that you obviously know the numbers in West Virginia and the numbers in Roane County when it comes to chronic health diseases, when it comes to obesity, an aging population, all of the numbers, the smoking, the tobacco use, all those bad numbers. And obviously, as a provider, part of your job is to help people who are suffering from problems associated with all these issues. But as you mentioned, this prescription for your health is really nice, because you get to attack this on the front end. And prescription for your health, honestly, a lot of the time is going to be prescribed by doctors. So is that something that you've already seen and had to do, is prescribe this prescription for your health already?
Oh yeah, actually I'm doing more and more as we go, because a lot of patients don't know about it. And then, like an example, there is a patient who is very motivated to exercise, and he's been going through like just decline in health, because just like sedentary lifestyle, and then suddenly I just was told that he just bought he wanted to buy a dumbbell to work out at home, and he didn't know about this, and when I told him and like his family, they're like, there's a gym here, like and there's like nutrition counseling and so on. I'm like, yeah, you can check it out, and as part of being a patient here, you can get access to the gym. I mean, their excitement, and right away, and even like they're like, can we get a referral now? We're gonna go to the nutrition counseling and go to the gym and stuff. So people actually appreciate it, and they actually commit to it, and they find it very helpful. So,
and we're going to talk with you again on another podcast coming up, when we talk about, as a doctor, how you approach talking about fitness and exercise and wellness when it comes to your patients. We love the proactive approach, but we obviously, again, know what the numbers are. And one of the main problems in West Virginia, one of the main problems in Roane County, is diabetes. That is a chronic health illness that we have in our area, in our state. And again, the numbers are what they are. So you still do have to be reactionary in some forms. So one thing that when we were talking with Doug Benson and Jeff Tanner and a few others about, we said, who would be great to talk about these GLP-1 medications? Now, they may have thrown you under the bus, Doc. They said that you could talk for hours about GLP-1. So let's talk about this. Let's dig into this. What is, number one, a GLP medication? And number two, how do they work? How do these things help with diabetes problems?
So just tracking back, the reason I love talking about this is actually, I just developed a passion for diabetes because, again, as you mentioned, West Virginia, it's one of the top numbers in terms of like comorbidities and obesity in the United States. So you see a lot of diabetes, correct? And I do see a lot of patients with diabetes almost like on a daily basis. And I developed a passion. I attended a conference for diabetes in Florida during residency, which was very helpful. And they've really focused on the newer like medications, the GLP-1 agonist, the one we're going to talk about. So this is why, and I see the benefits of it, which is, leading up to how we talk about what is a GLP-1. So a GLP-1 agonist is it's a glucagon like peptide 1 hormone. It mimics the hormone that basically regulates your blood sugar levels, digestion, and appetite, basically. These are medications that initially were started as treatment for diabetes. And then now recently they're actually been approved and used for also for weight loss as well.
One of those things that if people might not know the word or the name GLP-1, that's a medical term, obviously, something that your normal jargon is used with. What people may know are some of the brand names of this. So
absolutely.
Obviously, Ozempic, Victoza, Mounjaro, Trulicity, those are the things that people see on advertisements.
Yes.
And so that's what you're talking about here. You're talking about those Ozempics, those medications that are traditionally meant to help with diabetes. But let me ask you, how many studies about are these newer medications is what I'm asking you, or has this been something that's been in use long enough to maybe, and we may get into the side effects later, but what is the time frame for these medications? When did they come out? How long have they been in use?
I would say it's been a few years where they started, but I think as the years go by, they started with some of the daily injectables, which we'll talk about. Mostly they're dailies, and then now they're having more like come up with like the weekly ones instead. They started a few years ago, but then they started developing different ones as because they've done more studies on certain medications that they found like they also have some other benefits, like preventing cardiovascular risk, like heart attacks and stuff like that. So there are certain ones that actually have more benefits than others, and they've done tons of studies, like tons and tons of. There's actually evidence that they've done these studies over and over, and they've done them in patients with cardiovascular risk. Even sometimes there's some kidney benefit, but there's other classes that are better for that. But they've been there for a while, but then again, now recently they're seeing the other benefits like the weight loss and the cardiovascular benefits and stuff like that. And now there's actually one of the newer ones called Mounjaro. That's like a dual action, which I'll talk about as well. That's one of the newer ones that's been found to be a little bit more effective in certain aspects as well. So I think they're developing more and more of these medications. And there's actually a different indication now for sleep apnea, which we'll talk about as well.
Oh, wow. Okay.
Yes.
So you mentioned like many different uses, obviously, that we're seeing for these drugs. So if you're seeing a family member, if you're seeing one of your patients, who would you suggest maybe look at these medications? Like, who would be a good candidate for these medications, be it diabetes-based or any other form of illness that you talked about?
So let's say mostly it'll be a patient who has diabetes and they've tried, metformin and lifestyle dietary modifications. They went to the gym or tried a specific diet or try to cut off a lot of their, like high carbs meals and stuff like that. And their A1C is still uncontrolled. There's still, and then, that's the first aspect is the diabetes, right? Yeah. And then you look at, like what can we do, right? So you think about all the options. The GLP-1 agonist is one of them, and that comes into effect if somebody is unable to control their appetite, because it's hard. One of the signs of diabetes is polyphagia, which means like your increased hunger, so you're basically eating more. So patients who have this difficulty, you think about GLP-1 agonists because we'll talk about the effects, but it does suppress the appetite. So these are the top candidates would be for this medication. Another indication would be if they have like associated comorbidities like high blood pressure, obesity, sleep apnea, which kind of comes with the benefit of weight loss as well.
So when you talk about diabetes, obviously not everyone with diabetes is overweight, but it's kind of a nice addition with these medications that absolutely. They can help with that. Someone who may not be overweight but does have diabetes, that's still the main focus of these medications.
Absolutely, yeah. Although it has some benefits with weight loss, it is indicated for a reduction in A1C actually significant numbers. Like, I don't know the exact numbers, but you would say like above 1.5 in A1C reduction in like a short amount of time if you adhere to it appropriately. And obviously with dietary and lifestyle modification always is on top of medicine. Medicine is not it's not a magic tool. But yeah, it can be. Now, the only consideration in elderly patients who have like less, like low muscle mass and like adipose tissue, and they're like more on the skinnier side, you want to be very cautious with this medicine because of the weight loss. It can decrease muscle mass and adipose tissue, so then it'll actually become more harmful. Not really harmful, but you just want to really monitor them. But overall, yes, if somebody who is not overweight and they have diabetes uncontrolled, this would be a perfect it still works, and it'll be a great medicine for them.
Well, if somebody is, as you mentioned, elderly patients, you have to watch with the weight loss situation. How do you counter that with still putting the prescription for that medication? Are there ways that you can counter that with, I don't know, maybe dietary supplements where you gain your minerals and whatever you need? Or is it just say, you got to eat? Sorry, you got to eat even if you're not hungry.
Well, the problem is with this medicine is it does suppress your appetite. So you probably don't want to eat. And if you do, then you're going to feel full longer and sometimes faster. If it is there's so many contraindications for other medicines. Let's say if they can't take anything but this, in the elderly patient who is like really cannot, if you think they're going to be actually have more harm for weight loss, you'd want to avoid it.
Yeah.
But if it's just weight neutral and you want to monitor, you can, and you can do like Ensure, boost supplement and stuff like that. But overall, I've had patients who are above 65, weight neutral on a GLP-1 agonist and then tolerating pretty well. But mostly I'd actually have the comorbidities of the obesity and diabetes, which is almost like the top candidate for this medication.
I keep thinking in my head the tune from Ozempic. I don't know why that's hitting me right now. So again, these GLP-1 medications are these medications. If people aren't understanding GLP, obviously I didn't have a clue. I had to Google it to figure out what it was. But then I saw the names again, Ozempic, those kind of names that people see the advertisements for. And as you mentioned, a lot of research has been done and continues to be done on the benefits of these things. We'll talk about the side effects here in a minute, but you mentioned earlier that generally speaking, a daily medication, and people, if you think of diabetes, obviously people often think of insulin shots. They think of a shot daily. How do you prescribe this? How is it taken? Is it a daily medication? What is the situation with that?
So there's different types which work exactly the same way. Things like Victoza, if you heard of that, Saxenda, Trulicity. These are, Trulicity could be, but the Victoza and the Saxenda are the daily injectables. And the way it works is the subcutaneous. It's like giving yourself an insulin shot, and usually it's given in where there's a lot of like adipose tissue and felt like around the belly is one area, of the thighs and stuff like that. So the daily is just a daily shot. It's quick. It's obviously you do the same thing as you're giving yourself insulin. Versus a weekly shot is just again once a week, given the same way. And the way you tailor which one is appropriate is sometimes it's just availability as well. Like for me, if Ozempic, which is the weekly shot, is not available, sometimes, and also like insurance and coverage would be an issue with these medications. Mm-hmm. So if Ozempic is not covered or it's not available, Victoza, for example, the daily shot would be available and it'll be like at a more lower or affordable cost or even covered. Either way, they have the same benefits, right?
As the research has been going on with these things, do you find, and I don't want to get into a side conversation about insurance coverage, but do you find that more insurers are starting to cover these medications?
Yes, but mostly, obviously, for diabetes. Okay. And then now they have been some other medicines, like they're almost the same thing, but they're different doses that actually are indicated for weight loss. But then insurance always becomes a challenge with those type of coverage. But for diabetes, a lot of times, if now there's better coverage if they have diabetes and you actually have uncontrolled diabetes and they're a perfect candidate in terms of like they have comorbidities, they actually have more coverage with these medicines. Okay. I was gonna say there was one time where Ozempic was at a shortage, and it's not because I think it was because they weren't manufacturing the pen itself, and it was like nationwide. So I think that's when like the daily injectables were there, or and like, but there was some time where there was a shortage, but now they're more readily available.
Uh, People have said this, and I'm sure as a doctor, as a family care physician, that you may have heard all the hype around Ozempic and these drugs or these medications is miracles. Miracle, you lose weight, you do this. Now, we have talked about the benefits, and there are many and numerous and many studies about it, but nothing comes without risk, obviously. So let's touch on some of the risks maybe that you have seen in research. And again, I go back to advertisers. People always hear the risks or the side effects, and they're like, holy cow, am I really going to take this? It's going to cause all this.
Yeah.
It's just that it's not that it's going to cause that. It's just there are some risks associated with anything like that. And they may not be very large risks, but let's talk about some of those with regards to these drugs.
Well, everything has side effects and risks, even Tylenol, right? I mean,
Yes.
the daily headache or pain, for joint pain. But obviously everything comes with risks. So you want to make sure with these medications, patients who have history of or family history of thyroid cancer or even pancreatitis, you don't want to give these medications because they will, increase the risk for developing those conditions. And if it is, it's you readily, like usually don't prescribe them. In terms of side effects, well, again, the way it works is regulates your insulin, and I don't know if we're going to talk about it in detail, but just in general, where it slows your metabolism or your gastric emptying, so you feel full longer, and kind of signals your brain to say, oh, like you're not hungry anymore. So you want to make sure like risk of nausea, vomiting, and that can lead to like pancreatitis. Then weight loss, if you lose weight really rapidly, you can actually develop like stones in your gallbladder, which is very painful. And then you have your gallbladder removed. And then again, these symptoms may linger for a while, and it can cause hospitalization, especially pancreatitis. So really there's risks of that, you know what I'm saying? So pancreatitis, a lot of side effects in terms of like diarrhea, nausea, and stuff.
Well, those are the things that obviously, if you are a patient coming to see you, that's why you have conversations with your patients. You find their history, their family history. You address them. Each individual has different wants, needs, assessment data, whatever it may be, before you even prescribe these things. So a lot of these risks, I imagine, are heavily mitigated before you even prescribe them.
Yeah, I mean, you'll be able to tell from their family history, and if they're qualified for it. Like if somebody had a history of pancreatitis in their history, you know what I'm saying? Like you don't talk about GLP-1, and if they ask about it, say, I'm sorry, but you won't qualify because that will increase your risk of pancreatitis. You'll be in the hospital. Yeah. So it's kind of if you know the patient very well, that's what beauty of family medicine is. You like you said, these risks before, and we always double check and ask again, and then we always mention and talk about these risks before we prescribe. Like if there's no risk of any family history or anything, but we talk about the side effects, we make sure that we talk about the side effect, because they will say, oh, like I took it and I'm not feeling, I'm getting diarrhea, abdominal pain. What do I do? Like, you already warn them and kind of make sure they're aware before you prescribe it.
So with regards to this prescription for your health, and you being a physician and you being able to prescribe this program with people who are taking any of these GLP-1s that are prescribed, how do you address them with regards to the entirety of the program, in that nutrition is important for them, healthy workout regimen is important for them? What are some of the maybe suggestions you may have for them, complications that could arise from taking that while doing the program? How do you guys address that at the beginning and, of course, throughout the stages of the process?
Well, the beauty of the prescription for health and the wellness is they will kind of work together to do labs and monitor their progress in terms of like how much muscle they're losing, like to fat ratio, and and then nutrition counseling. Are they so you want to make sure they're not suppressing their appetite too much and again losing a lot of weight, because that becomes more harmful. And again, a lot of patients, if you want to take something that will help they'll think their A1C, you want your A1C to go down really quick or lose so much weight right away. So you want to actually, explain that this is a sustainable, like gradual process. And, we work together as a program. And the beauty of the prescription for health is they will look at the labs we do, and then they will also send us their like counseling and their like, what they talked about the patient, and then the wellness center, like how much fat to mass ratio and all that. So you can watch and monitor that. And we have a good communication system. So we kind of just tell the patient, like, take it easy, it's going to suppress your appetite. And then, go talk to the nutritionist, go to the gym, and then we kind of follow up all together. And then we do like 3-month follow-up to see how they're doing, because we're going to do labs anyways.
I love the way this program is structured in that everything is interconnected.
Yes.
You are a very important part of it on the front end as prescribing this program. Some people may not come to you first. They may come here and then decide to make you their family doctor. And then all of a sudden, you've got this web of people that can share information. It's almost as if there's no stone unturned when it comes to the health and wellness of your patients. And that's the reason I love this so much. And on top of that, as Kimberly Mertz said on our second podcast, it doesn't cost you a thing to do this program.
Which is
that
amazing.
is the greatest part about it.
I love it. Which is so motivational, right? Like, it just takes a barrier off, and it kind of is more of a motivation to do it.
So as we wrap this up, what do you see as the future of these GLPs? Obviously, you're a very big proponent of them. What do you see happening with this type of drug in the next 5-10 years? More of it? Any changes, modifications? And again, I'm asking you to look to the future. It's kind of hard to do, but do you see any crazy stuff coming?
Well, as I mentioned earlier, recently the FDA, I just saw the article, they approved one of the injectables. I don't know if you heard of Mounjaro. That's like it's a GLP and a GIP. That they don't know the GIP component exactly how it works, but it does have more benefit. But they just approved that for sleep apnea.
Okay.
Not for diabetes or weight loss, but it has to do something with the relationship with how when you lose weight, it kind of improves the sleep apnea, I believe. But just think about that. Like, whoever thought a diabetes medicine with and like a weight loss medicine will now be approved for sleep apnea. So who knows what it would be? And there's still studies about. Some of them have actually showed benefit with preventing cardiovascular risk.
Yes.
So like I mentioned, like heart attack stuff. So they're still studying is it indicated for just patient with heart disease? That is maybe one of the things, because there's another diabetes medicine, it's a pill version, like Farxiga and all that. It's a whole different class. It actually is now indicated in heart failure patients. Okay. And it's a diabetes medicine at the same time. So who knows what the future will hold? Maybe they'll have an injectable once a month. I don't know. I'm just, it's just, you're telling me to look in the future. I'm just thinking, the possibilities, but maybe they'll come with an injection once a month, different types, different indications. But they continue to emerge, right?
Yeah.
This Zepbound and the Mounjaro is one of the newer ones, and they're kind of talking about other ones. So there's always going to be possibilities for a lot of different varieties of things, and we look forward to seeing what the future holds.
Well, obviously, it's very exciting for you as a family physician.
Just starting too, so
yeah.
So it's exciting.
Very excited about these drugs, these medications that obviously all the research right now are showing are really truly. I'm not going to go with miracle, but very impressive. Let's just say that. For treating one thing that treats another thing that may treat another thing, comorbidities, whatever it may be. It's very exciting, the possibilities, as you said, for helping with the reactive medicine portion of this and helping people get better here in Roane County and in West Virginia. It's a huge deal, Dr. Dajjani. If somebody wants to come and see you and wants you to become their family physician, or if somebody wants to just get a referral to the Prescription for Your Health, how can they contact you up at the medical clinic?
They just call the Roane General Medical Clinic 304-927-6822 and schedule an appointment, and I'm happy to see them. I've actually had patients who've come into the Prescription for Health first, or talked to them, and I got a message saying like, hey, can you get, patient wants to establish and get a referral, and then, so it's like the other way around, a reverse thing, and then and then we just start the other way, and then obviously the more common one is they establish care and then refer them if they, qualify or they need, even just wellness fitness utilization, the center over here. It's just by being a patient. But yeah, they can contact the office and that number, and I'm still accepting patients. So.
Fantastic. Well, you're 3 to 4 months into our community. Dr. Dajjani, thank you for the conversation. We'll have another conversation
Thank you so much.
later on in
Absolutely.
our podcast. We'll be talking about medical fitness and all of that good stuff. Thank you very much for joining us here today, Dr. Mousa Dajjani. And again, you can find him at Roan General Medical Clinic. So this has been another episode of Prescription for Your Health and For Your Health, sponsored by Roan General Hospital.